few days have gone by since my last update. Spring has sprung in Ipswich,
How do I zoom in?
and the trees along Central Street are in bloom, a good omen for hope. I wanted to get to the bottom of just how Ipswich was doing during this crisis, so I visited Leahy Health for more information. Hi, what's your name and what's your position at Leahy?
I'm Dr. Carl Soderland. I've been a general internist in Ipswich for 41 years, and I am currently the medical director and division chair of the community practices of Leahy Clinic and now Beth Israel Leahy Health.
How do you think Ipswich is doing during this pandemic?
Well, we've been fortunate. If you look at the number of cases and if you look at the rate per thousand, we are among the lowest. Fortunately, in my practice, we've not had a serious case thus far. We've had several minimal cases, but not a lot. Ipswich looks like it's doing well so far.
What steps has Leahy Health taken to prevent COVID-19 from spreading?
Well, we've done several things. Early on in March, from a hospital standpoint, we stopped all elective admissions and elective surgeries. We stopped all outpatient appointments, and they expanded their ICU capacity at Leahy Clinic to go from 62 ICU beds to 165. And in our practices, we've actually closed and locked the front doors since March 17th. We have set up 3 sites that we call cohort sites, and these are places that we can refer patients to who need to be seen who don't have COVID symptoms. They're geographically placed. One is in Amesbury, one is in Beverly, and one is in Stoneham. And for those people who have COVID-type symptoms that need to be seen, if they're very, very sick, we do refer them to the emergency room. But if they're not so sick, then we do use one of the urgent care facilities that has the ability to get an X-ray and an ability to do a test.
If residents feel ill, should they contact this facility? If not, then where? When?
Absolutely, they should contact their primary care physician at any of their Leahy facilities. We're in the office 5 days a week. We're starting early in the morning. We're here till late in the afternoon. My staff is here. Physicians and nurse practitioners are here, and we're handling calls and advising people all day long. So absolutely, you should call your primary care physician.
How do your staff members protect themselves from being infected?
Well, there's 2 ways. Obviously, in the community and at their homes, they're socially isolating and separating the way all of us are doing. They're advised to wear masks when they're out, and in the office, we all have masks on all day long. So we are keeping a distance, both more than 6 feet, and we're all wearing masks.
Any idea how long this virus will remain potent and be a danger to the public?
I wish I knew that answer. If we listen to all of our leading researchers, no one's quite sure. We know we've got some countries that are a few months ahead of us, whether it's in Singapore or Hong Kong or China, and we're drawing on their experiences, but we really don't know. We don't know if it's a seasonal virus, it'll go away like flu does. We don't know if we have immunity from previous contacts. There's a lot we don't know, so right now it's to be determined.
Is there any other final things you'd like to say to the Ipswich residents?
Well, I think we're very fortunate where we live. There's lots of open space, and we tend to have room between a lot of our houses. We don't have a lot of major residential institutions, and those that we do have done a terrific job of keeping their residents safe and away from the general public. So we're fortunate to be here.
Thank you, Doctor. I appreciate it.
That's all you needed?
That's all.
That was quick.
Okay.
All right. I will shake your hand sometime else,
Sometime
David.
later. Okay, thank you.
Yeah, bye-bye.
Bye.
At the Riverbend Assisted Living property, Director Fercaloro locked down the facility very early, and so no cases are reported here. I then took a ride to Shaw's, put on gloves and my mask to see what was going on here. I was pleasantly surprised at the care and concern of Shaw's management, Shaw's staff, and yes, the shoppers too. Most people were following the safety guidelines.
What's it like working with a mask all day?
You can't breathe. It's awful. It's hot.
Hot, yeah. Thank you.
You're welcome.
You doing the touch-up verification?
And would you like the receipt?
Yeah.
This would have been a regular school day during normal times, but there's no action here today. The graduating seniors had put up these poignant signs.